everybody. Good evening. Thank you for hopping on tonight. My name is Lynn Poland. I am the founder of the Walk of Hope, New Jersey, a 4-year Resolve volunteer and support group host, certified integrative fertility coach, and co-founder of Kindred Beginnings, a family building support community. I am also the proud author of Creating Me, a customizable interactive children's book series for parents to explain conception through assisted reproductive technology to their little one. So this is a good one tonight. I am so pleased and thrilled to welcome Carla Scott. She is a 25-year practice administrator with Delaware Valley Institute of Fertility and Genetics. Carla is here tonight to help us navigate everybody's favorite topic, insurance for fertility services. So thank you so much, Carla, for being here and for holding our hand through this, because it's a lot.
Thank you, Lynn, for having me. Be happy to help you guys through this. It's going to be very informal. I didn't think anybody wanted a formal PowerPoint presentation at 7:30 on a Thursday night. So it's just me talking to you through my experience from my day-to-day in the trenches of infertility practice management. I have a little bit of history on me. I've been with Delaware Valley Institute of Fertility and Genetics for 25 years. Before that, I was a practice administrator for a medical billing company. So I do have a little bit of background with the medical insurance world and the day-to-day helping of our patients, as well as other patients in other practices, try to figure out how we can get the insurance companies to pay for what you so desperately deserve to be paid for. So, we'll be having some questions. I'll be happy to answer any questions that you want at the end. Just going to talk a little bit right now about what I know. I've been to plenty of seminars and workshops myself and have, fought for patients on the front line with insurance companies. Sometimes I've won, sometimes I haven't, but you have to do that. You have to fight for your patient. So in trying to find healthcare insurance that covers fertility treatment, it can be very time consuming, very confusing. Policies differ according to state law, and even companies that provide coverage may limit this to diagnosing fertility problems rather than treating the issue. If you're considering fertility treatment and looking at options, this roundup that I'm going to tell you kind of assesses some of the fertility insurance choices that are out there. My analysis compared factors like company reputation, premium price, network coverage, availability, limitations of some of the plans. So believe it or not, one of the best insurance options, there's about five insurance companies that I would recommend to you. The first being United, I can't even believe I'm saying this, United Healthcare, because it's not a favorite of medical practices, but I'm not speaking from a medical practice point of view. I'm speaking on your behalf. So United Healthcare is a decent insurance company when it comes to offering infertility benefits. Their deductibles can be kind of high, but they do offer 3 rounds of IVF if that's what your need is, as well as IUI, prescription drug coverage. They're a little bit tough as far as qualifying for their infertility benefit, but that's on us. That's on the medical practice to prove to them that you are in need of this service, that it's medically necessary, and that you're just not driving by and deciding that you want IVF, that you medically need it and you deserve it. So United Healthcare, the reason why I'm saying it's not our favorite as medical practices is because they pay us terribly. They pay us very little, but that doesn't mean that it's not a good insurance for you guys. The second one is Cigna. Cigna is a very good insurance company for infertility treatment. They cover IUI, they cover, first they cover diagnostic, they cover surgery, they cover IUI, intrauterine insemination, 3 rounds of IVF. And my favorite part about Cigna is they ask no questions. I do not have to prove to them why you need this. I don't have to prove to them that you've done 6 IUIs before going to IVF. There's no questions asked. If we have a contract with Cigna, they trust us in knowing what's right and wrong. And I've been able to get Cigna coverage for patients that may necessarily not meet the criteria of other insurance companies. Like, maybe somebody just wants to do one IUI and then go right to IVF. Maybe somebody had a vasectomy and really disqualifies you. They don't ask that question. So there's a lot of times that I've had really good luck with getting the patients covered for things that typically are not. Blue Cross and Blue Shield and Aetna are my favorite. They pay your physician fairly, and they are very generous with what they will cover for you. Both cover 3 rounds of IVF, unlimited IUI, prescription drug coverage. These 2 are pretty much sister insurance companies. They require pre-cert. They require me to prove to them why you need IUI or IVF. We have to fax them or send them via the computer your treatment plan, your history, why we think you need this. You have to qualify. Age is a factor with both of those as well. FSH level is a factor with both of those as well. If you're over an FSH level of 19, you're automatically disqualified. But, if you're a teacher, I know they have NJ Direct, Horizon Blue Cross Blue Shield, excellent insurance company. Aetna, a lot of the state agencies and municipalities have Aetna, also a great, great plan. Just be careful knowing who your employer is, as far as have they been chosen to be a fully insured or self-insured. That's a big difference. Fully insured plans are required to follow state insurance laws. Self-insured or self-funded insurance plans are exempt from state law, and employers do not have to follow the state insurance laws. So take, for example, a big employer in this area in South Jersey is Lockheed Martin. Lockheed Martin is a very big company, even though they are in the state of New Jersey, and New Jersey is a state mandated state. They do not have to follow those rules because they are self-insured, which means they choose what they want to cover and what they don't want to cover. I actually took a road trip to Lockheed Martin and met with the HR department just because we had so many patients that were coming from there, and these poor patients did not have coverage. They should have. It's a big company, but they chose to be self-insured, which exempt these poor patients from the mandate. So I went to them and I showed them our success rate, showed them the need, and they actually have changed things a little bit for their employees. They don't offer it across the board, which I understand, but they let them purchase an infertility rider. So if an individual who works for Lockheed Martin needs infertility coverage, they can go to them. It's not really, advertised. And they can purchase a separate rider for themselves, which covers just infertility. And most patients don't mind that. They would pay, extra money for, that coverage. And that way the company is not covering thousands and thousands of patients or employees for this, small need, but that small need is still a legitimate need. And so they were very receptive and open-minded to that. I've not been as lucky with a lot of other big corporations, but I'm trying. I went to Campbell Soup because they were the same way. Any of your religious organizations are exempt from it as well. If you work for a Catholic school or the diocese, they do not have to follow the New Jersey state mandate. It's frustrating at times, but it is what it is. So let's get to the marketplace plans. A lot of my patients say, Carla, can I buy something on the marketplace that will pay for fertility treatment? The first thing you have to know is that the federal government does not require insurance companies to make this coverage available. It also doesn't require businesses to provide this coverage to employees. So although the Affordable Care Act, Obamacare, mandates that health insurance companies in the United States cover 10 categories of essential benefits like inpatient, hospital, prescription, some prescription drug coverage, preventive services, but they exclude infertility. So there's still some growing and some, knowledge that needs to happen with this. But for right now, there is not one plan that you can buy on the marketplace that pays for IVF. Some of them, I've been able to get the injectable prescription drugs covered. They all have, I call them the jewelry plan, because it's always, silver, the silver plan, the gold plan, the platinum plan, they all have a jewel attached to their names, but they're all different. I'll be happy to go over those with you individually if anybody has a question, if you really are looking at the marketplace. But you're not going to find a plan there that helps you pay for IVF. It's just not available. Unfortunately, they'll pay for abortions, but they won't pay for fertility needs, which is very sad. So that's also a couple of things that, I've been able to help patients understand is their deductibles. The deductible can be overwhelming. You think you're picking a good plan, but it's $5,000 is your deductible. So you have to understand that the first $5,000 of any medical care is on you guys. So before they will pay a dime on your behalf, that's all on you. So you have to weigh that all out. Is it worth getting that insurance? Maybe I should just self-pay for something. Maybe I should ask my practice, where I'm going, if they offer discounts for self-pay patients. Most of them do. We do, of course. There's always payment plans and things like that. Injectable fertility meds is a huge issue. They're very expensive. One round of injectable fertility meds for IVF could be $12,000, and that's one round. So if the first time doesn't work, here you go again. You're going to buy another $12,000 worth of med. It's terrible. But if you have an insurance that will cover IUIs, intrauterine insemination, that means that they will cover the injectable meds that are important to go with that IUI. They're the same meds. We use the same meds for an IUI as we do for IVF. So a little tip, do a couple of IUIs and stockpile some meds. So now you can use them for, if you need it, an IVF cycle. No one, knows what you're doing with these meds. Your practice can, try and over order a little bit so that you can put some away, or you don't have to use them for that IUI. If you don't want to, you can put them away for, your IVF cycle, because you're going to have to self-pay for the IVF cycle. But if you don't have to pay for those meds, my gosh, that's, half of the price. Now you can do an IVF cycle for, $6,500 instead of, $18,000, something like that. So there's little tips like that can help you get to that point. Trying to think of any other insurance companies. Oh, AmeriHealth. AmeriHealth is also one that does not ask questions. So we've gotten patients covered for IVF, no questions asked, and it's paid for. So the two that don't ask any questions are Cigna and AmeriHealth. Both are New Jersey plans. Both are good plans. That's about all the tips that I can think of. You're not alone in this fight. We challenge the insurance company all the time. Why does it make sense for them to say no to an IVF cycle and then pay for like 7-8 rounds of IUI? That's ridiculous. They're paying more money in the end anyway. If I can prove to them that one round of IVF is all that's necessary versus paying for 7 or 8 rounds of IUI, it's just you need somebody behind you. We write letters of medical necessity all the time. Our physicians do peer-to-peer review, and we challenge them on it. It's a shame that, there's people making decisions for you that don't have the mindset or the expertise to do so, but that's what's happening out there. So can I start with any questions? I hope that covered some of it.
Yeah. So a question came in, how can we get medical practices to advocate for us? So it sounds like you do a lot of that advocating, and
Oh my gosh,
not all practices do that.
That's their job. If it's not happening, you need to change the medical practice. I mean, we fight for you. You can't do that. They're not going to do anything for a patient. They're going to bend a little bit for the fertility practice, and you have to find somebody that's going to advocate for you. That's their job. I don't understand why anybody would not want to do that. Well, I do, because they want you to self-pay because they're making more money, but that's not fair. So I would change until you find somebody that did that. There's a practice manager in every center. You find somebody that's willing to do that. Interview that center.
And make sure that they're patient-centered is what I'm hearing you say.
Yes, definitely.
Yeah. You had mentioned a round of IVF, that some of these cover a round of IVF. When you say that, do you mean retrieval?
Yes.
So
retrieve.
Yes. 3 rounds of IVFs means 3 retrievals.
Correct. Mostly, and most of them will give you unlimited transfers.
And what about so you talked a lot about New Jersey. We have some people on tonight that are not from New Jersey. And so if they're not in a mandated state, any tips, any loopholes, anything that we can do?
So the mandated states are Arkansas, California, Colorado, Connecticut, Delaware, Hawaii, Illinois, Louisiana, Maryland, Massachusetts, Montana, New Hampshire, New Jersey. Anything you can do. Well, I don't, my level of expertise is not of that nature, so I don't really know what you could do as far as advocating for yourself with your employer. I've had many patients go right to their HR department and say, I need help here. I need some type of coverage for fertility. So don't be afraid to do that. A lot of them will listen and try and help you. It's the best I could offer in that respect.
Well, that actually leads right into the next question, which is how can I get my employer to help me with coverage? Or you mentioned something about a rider. Is that something that people, if they're not in a mandated state, they can go to their employer and ask this? And how do they go about doing that?
You go right to your HR department and you say, I have this need. I understand that our insurance does not offer infertility treatment, but if I am willing to pay for you to add an infertility rider just to my plan, will you do that for me? And most of them will. All they have to do is call their broker wherever they get their insurance from, have that rider attached to an individual's policy, and you will pay extra for it, of course, but it's worth it. So try that first and see how that works.
Advocate for yourself always, right?
Yeah, always.
And I just want to bring back around that the practice manager there really is there to support you.
Yes, absolutely.
And if not, red flag.
Red flag, yes.
Red flag.
Yeah, my office is right here in the front line. Like I see patients, I'm open, my door's open to patients all day long. They're in and out of here, in and out of here. You should be able to walk into that practice manager's room and sit with her and discuss it. If it feels too corporate to you, it's not right. It's just not right.
The next questions are, are clinic prices negotiable?
Absolutely.
Is that only for self-pay?
Well, why would we negotiate an insurance company price?
Just reading the question.
Okay. So we have a contract with insurance companies. So our price for insurance, let's say our price for IVF is $10,000. So we bill Aetna $10,000 for one complete round of IVF. We don't get $10,000 back. We get maybe $5,000 because that's the contract. That's the price we've negotiated with the contract. If it's a self-pay patient, we charge the patient what we typically get back from an insurance company. So if we typically get back $5,000 from an insurance company for IVF, that's our self-pay price. So you should be able to negotiate. You can't really negotiate with an insurance company because they're going to pay you what they're going to pay. They're going to pay the practice what's already been set up in advance. But as far as like your we can't mess with deductibles. You can't mess with copays because that's a contract that we have as a medical practice with the insurance company. We have promised to collect your copay. We have promised to collect the deductible. So that's kind of how that works. We have to keep our end of the bargain up so that we can participate with these insurance companies.
I think that it's really important for people that are self-paying to know this, because I think, you know, you walk in, you see the prices and you think that that's just the price. So
Yeah.
I think it's really important that people know that most of the times your clinics will work with you.
Yes, absolutely. Yes.
And that's the telltale sign of a good clinic. So if they're not, maybe another red flag, maybe this isn't the clinic for me.
All right. And, you know, if it's all about the money, it's definitely not right. You know, we actually do a very small percentage of IVF. We have had much success in achieving pregnancy for patients without even doing IVF. But there are those instances, Lynn can tell you, that you need IVF. And don't be afraid to strike a deal with the insurance, with your practice. We do it all the time. You know, we take the profession of the patient into consideration. We take where they live. We take you know, their need. And you know, we've done quite a few pro bono cycles as well. Do we, you know, discriminate? Absolutely not. But we will help where we can.
That was the last question. Does anybody else have any questions for Carla? And just so you know, if anybody's typing, you can use the Q&A. You don't, people are texting me too, so you don't need to text me. You can use the Q&A or the chat. And I know that Carla, we spoke before this, and she's going to so generously make available to you her phone number directly at the office. And even if you are not a patient of theirs, she is still willing to speak with you to help you kind of navigate some of this, which is just
absolutely.
So,
you know, if you're
so
trying
generous.
if you're trying to pick an insurance company, if it's that time of year and you have a decision to make, call me. I will help you make the right decision for your situation. Yeah, you don't have to be a patient here. I get many calls from patients that aren't ours. Just, you know, there's no question that's silly. I've heard them all. So I'll be happy to help you, and you can run it by me. No problem.
And I'm putting that in the chat just for the people that are on. And for those of you that are watching the recording, this number will be posted in the little bio underneath. And this is her office number.
Yes, yes.
Any other questions for Carla tonight? I'm not seeing any come through, Carla.
Okay.
This was good this was really good information, and I think a lot of misconceptions maybe were clarified. I think, you know, some big takeaways. Advocate for yourself. Your medical practice, your practice administrator should be able to stand in your corner and really needs to be the liaison between you and your insurance company. And if not, be mindful of that. Make some decisions about that. And I think, you know, another huge takeaway is the negotiation of prices. If you're self-pay, see what your clinics can do for you to help you. I think that
and your ability to go to your HR department.
And your ability to go to your HR department and advocate for yourself there. Absolutely.
You know, some patients choose their jobs depending on whether their, you know, employer will cover them for infertility. I know people that want to work in the school system just because they have that coverage. So that's not an unusual situation at all.
I have a couple of women that I support that are looking into getting a second job at Starbucks for that exact same reason.
Exactly. Yep. Amazon, Starbucks. There's a growing number of corporations that pay for infertility.
Yes,
and
we
also,
thank them.
You know, some are even starting to pay for egg freezing. So that's big too, not just for patients that are undergoing chemo, but for fertility preservation. So that's an interesting new line that's coming down too.
Yeah, and that's a really recent development, but yeah,
Yep.
and it just like a shout out to all those companies that are offering and all those employers that are offering. Our
Yes.
community thanks you, because, you know, infertility is a disease. It's a medical condition. It's not a choice. It's not a luxury. Right. Carla, no other questions are coming through.
Okay,
so
sounds good.
I want to, I'm going to share my screen again, and I want to thank everybody for coming on. I want to thank Carla so much for your time tonight, for your expertise, for sharing some of these tips, and for so generously offering to speak with people and help them navigate it. And thank you to all of you that joined live today. And if you're watching the recording, thank you for watching. We are running this during National Infertility Awareness Week 2021. So the Walk of Hope New Jersey 2021 is still accepting donations. Carla and all of our expert speakers are volunteering their time to come join you for these educational workshops. So if you'd like to make a donation to benefit Resolve, please go onto our Walk of Hope New Jersey website and please do so. Carla, thank you so much.
Thank you. Bye, Lynn.
Bye. Take care.
Bye. Take care.